everyone, welcome back to my YouTube channel From 10 to Stars. For today's video, I would like to talk about how to prepare for the first chemotherapy session. For those of you who are new to my channel, let me introduce myself. My name is Conchita. I am 49 years of age and I am an oncology certified nurse. I have this channel because I was first diagnosed with colon cancer back in February. And when I underwent my first routine colonoscopy, I had my surgery done in March. The tumor was taken out. And today, April 14, marks the 5th week post-surgery. This coming Saturday, April the 16th, I will be getting my first ever chemotherapy session. So, what have I been doing in between? So, of course, I have met up with my oncologist and we have both agreed on a treatment plan, meaning what type of chemo regimen or what kind of chemo drugs I will be receiving. And pretty much I'm just waiting for Saturday to happen. So as I was thinking about the things I wanted to say in this video, it suddenly occurred to me that making this episode is a little daunting. So I'm like, what? I just wanted to make sure that whatever I say in this episode, whoever is about to undergo chemotherapy treatment for the very first time, I hope this video gives you a better understanding of what the process is, and hopefully you won't get confused with what I say. So I would like also to reach out to my fellow infusion nurses. If you think I have said something incorrectly or if I have missed something very important, please write it down in the comments. If there are any chemotherapy oncology patients that are watching this video, you may do the same, because right now as I do this video, a lot of things are going through my head, and since I am not really a trained speaker and English is my second language, I might just be saying things that don't make sense, and I wanted to make sure you guys get the right information. Okay? So I share, you guys give me feedback. Okay? All right. So what has transpired? I have met with my doctor, with my oncologist. For those of you who have not seen their oncologist yet, I suggest that you write down all your questions in a notebook. And please don't forget it, because that's what happened when I met up with my doctor. I wrote all my questions down and I left it at home, and I was struggling to, like, where is my notebook? I forgot all my questions. Anyways, so write down your questions before you see your doctor. If you can manage to bring in another person, to a person or two, to come take you to the appointment. So whatever is explained by the doctor, you have other ears listening, because you know, the cancer diagnosis is very overwhelming, and sometimes you just do this, uh-huh. All right, bring a companion. Um, but verify first with your clinic, because I don't know if some places have COVID restrictions. I know a lot. In my case, I was actually offered to do a video visit for my first consult with my doctor, but of course, I'm like, no. I want to meet you, my doctor. I want to see you face to face. So verify with the doctor's office how the initial visit is gonna be. I prefer the, of course, the one-on-one visit, because your doctor can see you, your doctor can touch you, can look at your body parts that's doing all that chaos. Anyway, so those are my tips. Write your questions, bring a companion, and what else? In general, when the patient first meets their oncologist, uh, that is the time where certain things are planned. For example, the doctor will determine whether the patient will need a central line or a port, a mediport, or if the doctor thinks that the patient needs to have certain diagnostic tests, radiologic tests. So in my case, I did not have to have a mediport put in my chest. um, I agreed with my doctor to try and see if we can do a peripheral IV infusion, meaning the medication, the chemo, will go through my vein and not through a device in my chest. And she did not require any other CAT scans or other imaging tests done prior to my chemo start. So it might not be the case for other patients. So that's what I'm saying. It all depends on the condition of the patient. And during that first visit with my doctor, I was also able to meet up with her nurse. And she gave me materials, reading materials about my chemo treatment. So I expect other facilities will have their own materials to hand out to their patients. So in my case, I was given a booklet that talks about um, infection prevention, the side effects of chemotherapy. Um, the nurse also, of course, had to discuss the drugs that I'm gonna be getting. So that all happened on my first visit. They already knew that I'm a nurse, an oncology nurse, so our conversation was pretty smooth. um, I'm like, okay, okay, okay. By the way, I did not bring a companion with me because I'm like, oh, whatever. Anywho, so what else do we need to do? In my case, I had to go to my local pharmacy to pick up my anti-nausea prescriptions. So I was prescribed 2. I may or may not use it. I will find out on Saturday. So I've seen patients where they have more anti-nausea prescribed to them. So it all depends on what their chemo regimen is, okay? In my case also, I am ordered to take oral chemo pills. So that is a totally separate order. In fact, I had to wait for my insurance company's approval before I could receive those chemo pills. And of course, I have to pay a certain amount for that. So pick up your prescriptions, okay? What other tip? Designate a companion, a driver for your chemo treatments, especially for the first one. Why? Because we simply do not know how a patient will react or respond to the drug, the first dose. So of course, on Saturday it will be my husband who will drive me to the infusion center. We still haven't decided yet whether he will stay around with me in the clinic or not. We'll see. We'll decide on it tomorrow, Friday. Anyways, all right. And lastly, before you can start your chemotherapy, you have to get blood work, labs. So I went earlier today, and that is how it's gonna pan out, or that's what's gonna happen as I get each round of chemotherapy. The doctors usually want new blood work 1 to 2 days before the start of a new chemo cycle, preferably 1 to 2 days. And the reason being is that we want to make sure that the body is ready. Your red blood cells are good, at a good number. Your white blood cells are a good number. Your kidney function, your liver function is good. So blood work 1 to 2 days before chemotherapy.
Okay, today we are going to take some blood.
That's right. Thank you for doing the talking.
Today we are going to take blood. I have you relax your arm, honey.
Oh, there you go.
Okay. Okay, here we go.
I got diagnosed with colon cancer. Yeah, all the stuff that I've been telling you about constipation and all that stuff. I'm like, it was me.
You know, how ironic is that?
I know. I know.
Oh my god, I'm so sorry.
No, I know. It's. Well, I'm older than you, okay?
You're not that much older.
Well, I'm gonna come back
Okay, here we
after chemo.
1, 2, 3.
Yeah.
Are you doing the one that this chemo makes you lose your hair?
No.
Okay, good.
It's not. It's gonna thin it out a
This
little
is
bit.
really nice.
Oh, thank you.
It's super pretty.
Thank you.
Make a fist for me. I'm a loser right now. Okay.
I know. That is so cute.
I know.
You're recording me being a loser.
No, you're not. I told you. I should have warned you. That's a vein that wasn't right.
Thanks a lot.
That is, we gotta figure this out.
And I swear I hydrated.
No, I felt it. It felt good to me. Am I hurting you?
No.
All right.
It's there?
Yep, it's coming.
Yeah. I'm not gonna see. I didn't get a port, so I cannot offer this vein for a
Forever.
for a blood draw. 4 rounds only, so
Okay.
I won't be back till like after 3 months.
Did you have to do colonoscopy? Is that how they
Oh
found
yeah. That was my first one.
Your ever first one
First
ever?
one ever, because I haven't turned 50 yet. I did that because I was turning 50.
Yeah.
So
You don't know how long you've had it for then?
the doctor says 30 years. Good job. Let me show. Is it okay if I show your
Hand
face?
model. Yeah. Only half of my face.
So,
I just wanted to add that for colon cancer patients, some of the chemo regimens require not only blood work but also urine specimens. So it all depends on what chemo treatment you are on. FYI, even if you are diagnosed with colon cancer, each patient will be getting a different kind of regimen and a different dose. So not all colon cancers are the same. Okay. Well, pretty much that is what I wanted to share for this video. So yesterday I decided to go to my workplace in Davis, and it is a 30-mile drive one way from home. I chose to go there because I wanted to see familiar faces. So yesterday I was able to see some of our patients who have been coming to our infusion for a very long time, and of course they're wondering, where have I been? I've been doing stuff. That's what I told them. I've decided to join your club. That's weird. Anyway, and I also saw, of course, my coworkers, but the crew from the laboratory department, as you saw earlier with the video that I posted. They all wanted to be in this channel, so that was done with permission. Shout out to our laboratory people. Thank you guys. We work alongside a lot. Anyways, and of course, my very own crew, the wonderful people at the infusion center, Miss Christine. God bless you, ma'am. I hope to see you before you leave. And Max, I miss you, Max. Karen, thank you very much also for all the encouragement, for all the text messages. You're the best. Tom, good to see you, sir. Thank you for keeping all the ladies behaved. Thank you for holding down the fort. And Miss Saima, I wore it. It fits. It's actually very warm. So thank you. I think this has become now my new favorite. So Simon knows that as I get oxaliplatin, I should keep myself very warm and stay away from anything cold. All right. So, oh, before I forget, my colleagues, former colleagues from Baltimore, thank you very much. So I just found out that it wasn't just Danielle, Miss Danielle Kashner, who sent me that care package, but it was, that box was a combined effort of my former co-workers. I love you guys. Miss Amy, Miss Connie, Miss Diane, Miss Mary, Miss Judy. I miss you all so much. Those were the people that I worked the longest. Our night crew, they were the best. They are the best. They are the best. Well, okay, someone might contradict me, but I was trained well by these wonderful people. And I was told that a new person that I haven't met, Miss Tierra, also pitched in for that care package. So whoever you are, Miss Tierra, I really, really want to say thank you for, giving to someone whom you don't know. That's me. So thank you. And I guess that's it. So today, now I had to finish this last segment of the video today on a Friday, which means tomorrow, Saturday, is my chemo day. So I don't know. I got a day off, another day. I'm thinking of getting a haircut. I'm also thinking of having to cook, so I don't have to cook on Saturday, Sunday, and even Monday. We'll see. All is good. So that's it. Thank you so much for joining me. I appreciate you all. Thank you for all your love and prayers. God bless you all, and till my next video. Uh-huh.
This is how much you're supposed to be drinking a day. Don't forget.
Don't forget.